Good afternoon. Make sure I don't. It's okay? Thank you very much for the opportunity to come and speak. Just curious, how many people in the audience are patients? Raise your hand. And how many are doctors or therapists? Okay, good. Okay, so I'm your doctor that didn't know anything about lipedema 5-6 years ago, and started seeing patients, reading a lot, and I came to the meeting last year and I learned a ton, mostly from patients. I sat Sunday morning in a group with some women, some of you may have been there, and I heard some things that really shocked me, and so that's how I came to have a journey over the last year that I want to share with you. Okay, nothing to disclose. So I'm Jeff Dittesheim. I'm a board-certified plastic surgeon in practice about 29 years. Did I lose the sound? About 29 years in Charlotte, North Carolina. I do all my surgery, unlike Boris, who does it in the hospital, I do all my surgery in the office in a Quad A, that's a certifying agency, Quad A accredited operating room for general anesthesia. Okay. So, how does surgery help lipedema? Okay, this slide probably shows up in some capacity every year at the meeting. But there's more in this slide that I really want to point attention to. The person whose pictures you see was a 25-year-old woman who was 5 feet, 132 pounds. She was one of the first women that I operated on. And like plastic surgeons, she came in and she had this body disproportion, a really tiny waist. And so I thought, oh, yeah, I can do liposuction for you because that's what I do, and I can make your legs look really good. I had no idea. In fact, there was no discussion, I'm embarrassed to say, of pain, swelling, mobility, quality of life. And so all I was thinking about was, can I get her legs and thighs to look better? Now, we know with surgery, so that's one point. Second point, we know with surgery, and this has been proven, and there have been two very good, one done by Dr. Amato last year, meta-analysis, which means all the literature, they look at all the literature and see, okay, does surgery make an impact for women with lipedema? And the answer overwhelmingly is yes. So what does it do? What it does is it improves the symptoms of pain, swelling, heavy legs, improves shape, improves body image, improves quality of life. Okay, hold that thought because we're going to come back to this in just a minute. Okay, so after the meeting last year in St. Louis, I heard a lot of things being talked about, and I thought, well, like all surgeons, you know, we're all basically insecure and arrogant. And so we said, well, if the surgery has complications or is frustrating, then we just have to learn how to do it better. And so why don't I go someplace that is like a center in Germany and see what they do and see if I can replicate that. And so Tom Witt, or Witte, I think it's pronounced properly, he wrote a paper in 2021, and these were the findings. And these were basically young women with a mean age of 35. They were stage 1 and stage 2 patients. They had about 5 to 6 liters of fat removed when necessary per session. And in the paper, it said, okay, this is great. All the parameters they measured for pain and swelling and bruising and mobility were out of the park. They were all great. None of his patients had recurrent disease in the treated areas, and they lost an average of 5.6 or about 12 or 13 pounds over the 2-year follow-up. So I thought, wow. And he was using water liposuction. It was the first paper to say water liposuction only. And so I was like, wow, that's what I do. And so I'm going to go over there and see what he does. Now, one thing I want to call your attention to. On the bottom, and this is from his article, it said that the rationale for treating lipedema with surgery was to avoid or prevent the progression to lipolipedema or lipolipedema. In other words, the assumption was every woman was going to get lipolipedema at some point in her life, and if you did surgery early, you could prevent that. Hold that thought too. Okay, so this was basically what I was doing before I went to Germany. This is a common patient. She was 37, and she had lipedema of her thighs and legs, and I treated her in 2 sessions. And in order to really be empathic to patients coming in saying, look, this is expensive, the insurance is not covering all of it, or it's not covering any of it, and how many stages do I have to have? So I thought, okay, I'll try to do as much as I can in each stage. And so I marked the painful areas, and those were the areas in red you see there, and then I marked the other areas and so on, and tried to do, as much as I could in 1 session. Okay, so this has a lot of stuff on here, so let me just take it one step at a time, because I really want to share this with you. So this was the early experience, 2019 to 2022. The numbers that you see on the right are reflective of the 4 patients who are in the box. I'm going to tell you about each one. Now, as a background, I had done water liposuction for many, many years, from 2012 forward, and over 1,000 patients. It's just something I picked up and I was interested in, so I learned a lot about it and had a lot of experience. And when patients, like the patient I just showed you, showed up in my office saying, oh, water liposuction is good for lipedema, can you help me? Then I said, yeah, I can help you, but I could help her with surgery, but I didn't really know enough about lipedema at that point. Anyway, so I was treating patients, legs, thighs, knees. These 4 boxes represent 4 women from age 25 to 60. The top 2 were 60, and the bottom left was 25, and the bottom right was 51. The weight range, this is a typo, it's not 216, it's 261. So the range was from 125 in the bottom left to 261 on the bottom right. Okay. Now, when I see patients, and there was stage 3 on the top, and it was a large stage 2 on the lower right, and probably stage 2 on the lower left. Okay. What I did was, I thought, okay, I don't have a hospital like Boris, and I can't do so much, but I want to help these women, so what do I do? And so I ended up treating these women with a fat removal. This is not aspirin, this is actual fat removed of between 8.8 and 24 pounds. That's huge. When I look back on that, it even makes me shudder, because I wouldn't do that today. I think it's just way too risky. And so liposuction, cosmetic liposuction, okay, we agree that about a 4 liter to 4.5 liter liposuction is considered a large volume, and that's the limit. In the operating room, outside of the hospital, 5 limit aspirate only, meaning 5 liters is all you can take out of fat and fluid. Anyway, point being that these women really had a big change, and I thought, that's great. Now here's the best part. The woman on the top left was 60 years old. I spoke to her 2.5 years since the surgery, it was just recently. And I said, how are you doing? And she only had legs and knees. And she said, I'm great, I'm walking, I have no difficulty with walking. I have occasional feelings of lipedema pain in my thighs, but I'm really very good. Okay. You can see that in the picture on the upper left, and this is important for how much fat to remove, that one leg was 10 pounds of fat. So when we talk about how much fat are you going to take out, and that's about 4 liters, 4.3 liters. So these are, just to do her 2 legs, I got scared when I was doing this, because it was early in this large volume experience. I took out 10 on one leg and 4 on the other, because I thought, that's got to be too much. And I checked her hemoglobin in the operating room, and she did fine, and she didn't have any complication, but then we brought her back and did some more liposuction. In the lady on the upper right, she was also 60. She had had 1 session of liposuction, and then I did more liposuction on her thighs and did a medial thigh lift at the same time. But what you're seeing there also 2 years later was after she lost about 15 pounds, and she became mobile again and was able to exercise. The woman on the lower right was 51, and she was 5'7", she was 261 pounds, and I took out 10.7 liters or 24 pounds. That's huge. It took her about 3 weeks to recover. She was anemic. She was a nurse. It was a really, really hard recovery. And maybe I should have given her some protein pre-op or doing something else, but just treating her legs circumferentially, her knees, and some saddlebags, because that was a lot. Okay, let me speed up. So when I went to the FDRS last year, I noticed a couple of things. There were lots of different surgeries, local, general, how much fat to remove. But what was really impactful was the patients who I met, and they were asking questions like, should I have surgery? Should I go to Germany? Should I not go to Germany? How much should I have to pay? So I thought maybe the magic was over the rainbow, and it was in Germany, and this is Mulheim, Germany, at sunset. It was really pretty. I was very lucky to be invited by Dr. Witt to go and observe with him. So their clinic is a lipedema specialized clinic. They do about 8 to 10 lipedema surgeries a day, 4 days a week, 4 surgeons. Dr. Hecht started the clinic about 15 years ago. They've developed protocols, lots and lots of experience, and the paper that I showed you before was from their clinic. Basically, they do large volume lipo, up to 6 liters. They keep patients overnight. They do oral replacement instead of IV, and they use flat neck compression. So this is their protocol. Before surgery, all patients get flat neck compression. Dr. Heck, I spoke to him. He said this was a really, really big thing, was to make sure the patients are properly prepared before surgery. So for 6 weeks, they get flat neck compression, maybe added lymphatic massage, and then when they come to surgery, they do up to 4 sessions. They do thighs first. If it's a larger patient, his thighs are done and buttocks are done in 2 stages, then the legs, then the arms, and about 8 weeks between sessions. They don't do any skin excision until a year later after all this liposuction has been done. And how much do they remove? They remove 6 to 8% of total body weight. So a 200-pound woman, 8% is 16 pounds, but he told me that 6 to 8, it didn't make any difference in terms of the results they saw. These are to show you that these were beds overnight with a bar. They had 3 patients in a room to recover, a lot of good peer-to-peer support. I saw these women after surgery, and they were up walking around. It was great. They really were doing great. Okay, what did it cost? Because there was a lot of discussion about going to Germany because it was cheaper. Basically, and I'm happy to talk to anybody about the further details, but their surgeries were about $8,000 and about 7,400 euros. And the extras were lymphatic massages and garments. Okay, that's for a German person. If somebody here went over there for surgery, it estimates about $14,000, or if you went with a companion, about $16,700. And in my office, the surgeries that I showed you in the previous slide are between $12,000 and $15,000, $16,000. So it wasn't really cheaper. Okay. So I came back from Germany in October, and I thought, I've got it. I'm going to do their protocol. I came into my operating room. I repeated it. It did take an hour. And I was like, wow, I really can do exactly what they do. They were good surgeons. It's like, there's no need to go to Germany. And let me just say as a caveat, that's one clinic I went to in Germany. It doesn't say all German clinics, right? There are other experts in Germany, other lipedema clinics. This is just one clinic, my experience. And I thought, wow, this is great. I've answered a lot of questions about surgery and the benefits of surgery and so on and so forth. But here was the catch. I saw patients who had the lipedema come back. And when I saw Shane last year, and I said, why are there so many patients not having surgery? And she said, a lot of these women have had surgery. And I thought, whoa, I don't want to be doing surgery only to have it come back. And then I sort of did more research in literature, and Dr. Herbst has written all about this. In her paper in 2021, she showed that the patients that responded to her survey, 25% of them had the lipedema come back where it was operated on, and over half, 61%, it came back somewhere else within 6 months. Well, that's a lot of risk and a lot of money to have something come back. So here was a patient of mine, right? She was a young woman. She had surgery. It was 2.3 liters of fat removed, did her legs and knees, and I thought, this is great. And look at her tummy. This is 1 year later. She had gained 15 pounds. What we saw, and these slides are 1 year later on the left as well, and what we saw was that the fat didn't come back in the legs that had been operated on, but in her tummy and some in her thighs, that's where she collected the fat, not surprisingly. Okay, well, that wasn't good. We weren't controlling the disease. We were just providing improvement. She would not take any diet. She didn't follow any special diet or elimination diet or any GLP-1. Okay, So this is where I am in my journey, and I've tried to be as transparent as I can in answering the questions that I heard women ask last year, like how much fat should I have surgery, should I not have surgery, this last slide. And so what else did I notice? I noticed, and I just saw outside, that Lipedema Foundation is now collecting data on GLP-1, patients who are taking GLP-1. That's so exciting, because what I noticed was that patients who took GLP-1s, they did a lot better. Before surgery, sometimes they lost 80 or 90 pounds. It didn't necessarily fix all their lipedema, but sometimes, in several patients, their weight decreased, their lipedema decreased, and sometimes their symptoms decreased. So this is my thinking right now, and maybe after listening to other talks I'll change, but is that I encourage patients to do an elimination protocol. I hate the word diet, and really try to define what Dr. Amato has shown and Dr. Herbst has shown, that there are certain foods that are going to be toxic for each person. Really, really have patient participation in this process. And so, and then at the same time, really consider GLP-1, even if there's not an excess weight, but for the inflammation effect. Flat neck compression, which I talked to the Juzo rep, now I think we'll be able to get those, which I think is really great. And then maybe some new anti-inflammatory supplements that I don't know about yet. Surgery, I'm not sure what the role of surgery is right now. But I can tell you that those surgeries that Dr. Boris showed you, they are big surgeries with lots. He can do it because he's an expert, but that's a big, big operation. So I don't really want to do that. And so maybe surgery is for the resistant lipedema. I don't know, but surgery, I'm not sure where that is right now. And so the goal is, ideally, and maybe next year we'll come back and we'll be able to say this, is that we want surgery to have a profound, lasting effect. Right now, we know that surgery will improve the symptoms. But without diet control and without GLP-1, there's no confidence. I don't have any confidence that that patient is going to do better long term. And so this has to be really thought of as a totally different paradigm. And that's what Dr. Amato wrote about in his paper in 2021 when he showed 5 patients who did better without surgery. So, and I know Dr. Wright has been using GLP-1s in his practice. And I did, just sort of as a final word, I was really curious about this. So I put a post on Reddit. Some of you may have seen it. I said, I'm a plastic surgeon. I'm treating lipedema. If you've had a GLP-1, tell me your experience. And 20 women wrote back and told me what their experience was. In every single case, it was a positive. It wasn't always the same, but it was a positive. And I thought, wow, this is going to be a paradigm shift. So I started treating cosmetic liposuction, like in the first patient. I then moved to trying to treat the painful areas and try to be efficient. I went to Germany and I saw their protocol, and now I'm back here trying to understand, where does surgery fit in? So that's what I have to share with you today. Thank you.